Hi everyone, it's Andrew here from Peak Chiropractic Limited, and what I want to talk to you about today is ankle dorsiflexion. So first thing, what is ankle dorsiflexion? Ankle dorsiflexion is the movement that occurs when you bend your feet and toes up towards your shin. Okay, so what that would look like if we quickly just drop down is it would be the movement of taking your foot up off the floor up towards your shin. Okay, so that movement there is what we call ankle dorsiflexion. Now that movement's really important for a whole host of things, not least of all is your gait, walking mechanisms, and also the transmission of force from the ground through the feet and legs into the lower back and then up through the arms and shoulders. What research has shown and what we see time and time again in the clinic is that if there's a difference in the amount of dorsiflexion that you have one side compared to the other, that's a really big predictor of lower back pain. Okay, we see a lot of lower back patients who have pain, who also have that limited dorsiflexion either on their right or their left hand side. If people are popping in every 3 or 4 months for a bit of a routine checkup to make sure they're going to be okay for the next 3 to 4 months, one of the big things we also look at is ankle dorsiflexion movement as well. And even if someone's pain free, if that ankle dorsiflexion has gone from equal and it's starting to reduce on one side, we look at why. Okay, and sometimes we directly treat the ankle, other times we treat other areas that are affecting that. But we like to maintain equal ankle dorsiflexion to make sure that the forces going through the lower back when you're walking or standing in a weight bearing situation are being distributed evenly throughout the body and they're not stressing the lower back at all. Okay, so that being said, and knowing the fact that dorsiflexion is a very important thing to look at, I want to show you one quick way that you can assess this for yourself at home. Okay, and all you're going to need is a wall and your own 2 legs. Okay, so I'm just going to drop the camera down a little bit so you can see what I'm talking through. What you're going to need is just a flat wall, okay, that you can get a clear bit of view around. Okay, all you're going to do is you're going to take one foot and you're going to lay it lengthways along the wall, so you've got a foot's width away from the wall, and your next foot is going to go up against that. So your foot is approximately 1 foot width away from the wall. Okay. Now in a slight split stance, all you're going to try and do is touch your leading knee to the wall. Okay, and you need to be able to touch the knee to the wall without your rear heel elevating off the floor. Okay, so all I'm going to do is I'm going to knee to wall, and I can touch there. And my heel, if you can just about see it, is still on the floor. If you have to lift the heel up to get that knee to the wall, or you can only get so far before the heel comes up, or you have to move the feet, you've got a limitation in ankle dorsiflexion. Okay, so that would show us that we've got a limit. What you need to do is you need to do the same thing on the opposite side. So we're going to take left foot against the wall, pop the right foot in, so we're a width away. Slight split stance, and we're going to touch, in this case, my right knee towards the wall, and that one goes down nice and easily, and my heel is still on the floor. Okay. If you've got a limited dorsiflexion, that's absolutely fine. Okay, we could work on that and see what else would benefit from that, but that's not too big an issue. What we're more concerned of looking at is if you've got one knee that can get close to or touch the wall, and there's a big difference on the other leg. Okay, if you have a big difference between one side compared to the other, even a small difference between one side compared to the other, that's something that would need looking at and addressing as a potential cause of back pain or a predictor of future back pain from that point of view. Okay, if that's an issue, we are going to produce quite a few videos going forward in terms of how to mobilise the ankles, but that exact test that you've just done can work perfectly well as an exercise as well. Okay, so all you would do is you'd set yourself up in the same way, foot lengthways, foot width, and you're going to have yourself standing, and all you would do, keeping your back foot heel down, is you're just going to try and keep moving your knee towards the wall. Okay, you want to try and move your knee outwards towards the wall 10 times, straight over the toes 10 times, and then inwards past the big toe 10 times. Okay, And you can do that for 2 to 3 sets per leg, or on the affected leg, 2 or 3 times a day. And over a 3 or 4 week period, that will start to build some mobility into the ankle joints and hopefully start affecting your back pain as well. Okay? If there's no joy with that, we can have a look at some other banded exercises, but you may actually need some manual treatment into the ankle, or the problem may not be coming from the ankle itself, so we'd have to have a look at what else is going on around your pelvis, head, neck, jaw and eyes, which are all influencing that foot. Okay? So if you look at this video and you've got a difference one side compared to the other with that dorsiflexion, drop us a comment, drop us an email, and we can have a chat about that and send you across a free report about how that may affect your back pain. Thank you very much for listening.